channel. This is Jamie Naftali, and this is the only channel, it is the only platform whereby we talk to mothers, to the caregivers, to everybody on the common illnesses that affect children while growing up. Here we talk in a language that every person is able to understand. Here we want to gain knowledge. We want to have the know-how on what really happens to these babies while growing up. So I welcome you to this episode. And if you're new, please hit on the subscribe button to be part of this wonderful family. So welcome to this episode. And in this episode, we are doing the side effects of the drugs that are used in controlling convulsions. We already said which drugs to use, how to use them, and now we want to know what side effects that they cause. If we misuse them, if we overdose, what are side effects, and we are going to say that they are very, very serious, and hence my fellow professional caregivers, we should be very, very, very keen and very careful. So side effects of Diazepam and Phenobarbital. Remember the two drugs that we are using. We said these two drugs, we find them at all levels of the health facilities. So to start with, both drugs, both the Diazepam and also the Phenobarbital, they are known to cause respiratory depression, and more commonly if the dose is very high. And we mentioned that. So this, we don't want to lose these babies. The babies came to hospital to help them, so we don't want again to give high doses and cause more problems. We are saying they cause respiratory depression, very, very serious. How does this respiratory depression maybe comes about? It causes rise in carbon dioxide in the blood. So the carbon dioxide in the blood rises, it comes up. Hence, the blood vessels in the brain dilate. And in case of infections like meningitis, malaria, and any other infection, this now causes the respiratory arrest. So that's how it comes about. So the brain vessels dilate and infections travel so fast, and this now causing the respiratory attack or the respiratory arrest. So the respiratory system is the system that the breathing system. So you can imagine when the breathing starts getting compromised, so we are going to have problems. And it is because of just overusing. So we have to be very, very keen. We have to be very careful, giving and using the right dosages and the right route. We say there are routes that we use in each drug, and we have the routes that we completely do not use. If you haven't watched, please check on the previous episode so that you are not lost and we move together. So this is it, because that is the most major side effect, the respiratory distress, and we have said how it comes about. So then, in summary, because we are now concluding on convulsions in children, so in summary, what have we said? What are the most important points? Maybe to pinpoint on the summary of the whole topic. That first thing is that the ABCD approach should be used while treating convulsions. Remember, we said it is the first thing before we proceed to giving drugs, to giving the anticonvulsants. So we should do the ABCD management, and we said what it's all about. If you have not watched again, go back to my previous episode. Another summary note is that Diazepam and the Phenobarbital, when used well, they are safe and effective for controlling convulsions in children. So when you use them well, the right dosages, like we have said, the right way of administration, the right way of giving. So those two drugs are good, and we say they are in all levels of health facilities. So if they are used well, they are going to control these convulsions. Another summary point, number 3, is that overdosing or use of the wrong routes in administration can be very, very dangerous. This we have just said, we have just talked that we should be very, very careful, very keen in giving these drugs. Yes, they are going to help, but we are again saying that we should be very, very careful. About administration, With diazepam, we say it is another summary is that diazepam we only use two routes, and that is through the IV, which is the first route and the best, and we give the dosage. And another route is through the rectum if the IV access is not gained. If you're not able to find a vein to put an IV, we go ahead and do the rectum through the rectum. We said it is through the anal canal, the behinds of the babies. We want to put this drug. It is very, very well absorbed there. And we said again how to give with the syringe, putting a whole of it 4 to 5 centimeters being inside, so that the whole drug is not going to be lost. All that we said in our previous episode. So that is another way. It's another thing that we are saying about administration. Again, when it comes to with diazepam, again, we say we should never ever, not the word, this never should be in capital letters, people, professional caregivers, we should never give diazepam through IM, through the muscles. Remember we say through the muscles, it's either here, this is the muscle, through the thigh, injecting the thigh, and also the behind, the gluteal, we call it the gluteal muscle, those two muscles behind. So we should never give IM. And we mentioned, we say when we give IM, it has slow absorption, and we find ourselves, because we are in a hurry, we find ourselves giving first dose, second, and even the third, and the drug ends up accumulating so much and so high levels in the blood, and eventually it causes what we have talked today, the major side effect, which is respiratory distress, and we have problems. You can even lose these babies. So this is very, very serious, and it is very important to note that never give diazepam through IM, through the intramuscular, through the muscle. The intramuscular route should never be used. We say the phenobarbital one, we have now, it is the one we use the IM. We have the loading dose and the maintenance dose. And the maintenance dose is the oral, the tablets most babies are given to maintain. And we are saying it is, we say the dosage for the maintenance. So I hope this is clear. And with that summary, guys, we come to the end of convulsions in children. Well done. If you have any questions concerning convulsions in children, either the way to control them, how to go about it, mothers, you have gained knowledge, anything, please pin down your comments down, ask anything, ask any clarifications, because these are very scary things. It's very, very scary, and we don't want mothers to get scared. Some mothers will just leave you with the baby on the table. They're very, very scared because maybe it is their first time to see the baby convulsing. So now you know, you have the knowledge, and what you can do, you are able to see. And thank you so much, guys, for listening to me. Stay tuned for subscribing. For those who have not subscribed, please subscribe so that we may move together, and yes, so that we may learn together. Turn on your notifications so that you're the first person to know whenever I post a new video here. So thank you, people. Till next time.